countries represented in our group that most countries make reference to the OIE terminology in their overarching national legislation. However, within each country there are many, many, many different names for these people, whoever they may be. That varies from country to country and, of course, between Anglophone and Francophone countries. Some countries have very strong feelings against the use of the word para as being implied to be some kind of pseudo person and a non-professional. And there was also some feeling, mostly from me, about the redundancy of the term para in the absence of the one being assisted, because a para is an assistant to somebody else. And mostly these people, in many cases in Africa, work actually by themselves. There was a lot of debate about community animal health workers, of course, and there was debate whether they should be included at all as veterinary paraprofessionals. And the group, I think, felt that the OIE should look at this in some way. Okay, so we started by looking at community animal health workers who are generally trained for a matter of weeks, occasionally months. They may get initial training, basic training, then some refresher training. But they generally carry out fairly basic tasks in the field. Generally, they may lack very advanced education, may only have primary school education, but they're importantly community-based and often are farmers or livestock keepers themselves. So they may do this role on a part-time basis, not necessarily full-time. They may be paid, they may not be paid, depending on the situation. Lots and lots of different types of training in this category. The next category we identified had many, many different names, of course, from livestock assistant, veterinary assistant, field assistant, animal health assistant. And it was felt at this point that we clearly needed to differentiate between what are normally formal government titles for jobs in the civil service versus a professional kind of category. And I think this is a difficulty with a lot of this issue around terminology, that there's a legacy, of course, from the history of veterinary services in Africa, where people were, technical veterinary people, animal health people, were employed by the government. So this was a factor in the multiplicity of the names. So these people, whoever they are, had 2 years of education normally, and received a certificate. They're frontline workers, they're very field-based people relating directly with farmers. They may do vaccination, they do extension work, and it was of course admitted that in the real world they often have to work by themselves, doing whatever is necessary to assist farmers. The next category was the 3-year diploma holders. And again, lots and lots of different names: livestock officers, animal health technicians, animal husbandry officers, veterinary officers, and then this word technologist appears at this level as a veterinary technologist in some countries. These people generally believed that they can start to treat sick animals in a more effective way, perhaps. In many countries, they're allowed to actually own and manage drug shops. And importantly, I think, there were people who said this is when people can more formally be allowed or enabled to work on their own. The next category is the degree holder who may have a BSc or an HND. I think that was mostly in Nigeria. And these are more advanced, obviously, people, and they may become more specialist in working in laboratories, for example, or receiving further training and becoming more formally recognized government meat inspectors. Again, lots of different titles, animal health officers, all sorts of kind of titles came in here. And generally, because they're more advanced, they may work indeed more closely with qualified veterinarians. But importantly, and again, I put it in bold here, cannot sign certificates at this point, at this level of training, but do a lot of advanced work and work very often in perhaps more sophisticated situations and positions, working maybe with a more specialist team, but again, capable of working by themselves in certain situations. Then, of course, the next one is the veterinarian or the veterinary surgeon, who typically has a 5-year training as a minimum and come away with, in some countries, a Bachelor of Veterinary Medicine or a Doctor of Veterinary Medicine, as in the situation in Ethiopia. And, of course, they play lots of different roles in the government or in the private sector. And at this point, of course, they can start to take some legal responsibility for different important functions, and so can play the role of actually signing certificates. And then beyond this level of training, we identified the challenges that some people face when they get more advanced degrees, and I think really that terminology of those category of professionals will be according to the organization in which they're employed. If they're in a research organization, they'll have scientific type titles. If they're in the government, then they'll have the normal government titles and so on. So I don't know necessarily that there's a need for us to kind of invent new titles, because I think there's lots of titles out there for these kinds of people. But I have met people in this room who have expressed some frustration. I think there was a gentleman from Nigeria I met on the first day who was classified, I think, as a paraprofessional, even though he actually had a PhD. And that didn't really seem right, and that had held him back in his career. And it really seemed really quite silly. So I think that's what we did in Group 2.